Brain health is something many of us don't think about until later in life, but experts say the workplace is one of the most powerful places to start.
Yeah, from stress and sleep to movement and social connection, our daily work environment can directly impact cognitive health. The Alzheimer's Association is launching a new initiative to help employers make brain healthy choices easier and more accessible.
Joining us now to talk about this, we have Dr. Laura Huth, community educator of the Alzheimer's Association of Greater Pennsylvania chapter, and Kristina Wiegand, Vice President of Employee Benefits at Marsh. Thank you both for being here. And it's just such an important conversation because I think that everybody can relate to this. We all deal with stress and lack of sleep and all of that while we're at work. And so what a great place to start.
Mm-hmm. Absolutely. I mean, we spend so much of our time at work and, we only get one brain, right?
Yeah, right.
We are born with one brain, so it's never too early, it's never too late to start taking care of that brain. And what better place than where we spend most of our time? I know I spend most of my time either at my office or in my car on my way to and from my office.
Right,
so.
Yeah.
Having that time is really helpful, to take care of yourself and to learn how to take care of yourself.
Yeah, those hours, they really do add up at work. So tell us a little bit about the Brain Health Program and how it all works.
Absolutely. So the Brain Health Program is brand new. We've known that brain health is important for a really long time, and we're so excited to be able to offer this opportunity to employers to take this assessment of your workplace and figure out what your workers need for optimal brain health, whether it's learning about sleep or exercise or better diet or, making goals as a group to engage in more movement, taking movement breaks at your desk. There's so much that's offered in this program that can benefit the workers in any organization.
Well, I think for us, we might recognize that and do as much as we can, but a lot of it is out of our control. And so, Kristina, why should employers care about this? Why should they step in and really lean into this program?
Yeah, so I work with employers every day, right? And I understand that employees really want that whole person wellness. It's not just about, hey, let's do a 10,000 step walking challenge for 2 weeks. It's more of I want financial health, I want, that brain health, that physical health, and it all goes hand in hand. So it's really important to have kind of that easy kind of toolkit for employers to say, hey, here's some things and some tools to use in order to be able to help your employees thrive as productive employees, as well as, have a healthy life and a healthy family.
Yeah, if someone is sitting at home right now and they're listening and they're loving what they're hearing, they want this in their workplace, this particular program, how do they advocate for it?
Yeah, so it's really easy. All you need to do is alzheimers.org, and you could go and take an assessment, and it will actually ask you some questions about your organization that say, hey, what's your current wellness program? It'll actually rank you on a level of silver, gold, whatever that status is, in terms of how well you're already doing in terms of brain health. There's so much research and development right now happening that there's always more to learn, right? So once you take that assessment, it'll give you a toolkit that's ready to go to deliver to your employees.
Dr. Huth, we know what happens to our bodies when it's under constant stress and the cortisol and how bad it can be for our bodies. Why does the Alzheimer's Association want to be involved in this and taking care of something that isn't necessarily Alzheimer's related? How do those two things go hand in hand?
Honestly, my work with the Alzheimer's Association, I am working to work myself out of a volunteer position, right?
Yeah.
We want Alzheimer's to be eliminated, and the best way to do that right now is through brain health. 40% of our risk factors are modifiable. You can't change, you can't change your age, you can't change your genetics, but you can change the way you sleep. You talked about cortisol. If you're not sleeping well, you can develop cortisol toxicity. When we sleep well, our brains are cleansed at night to get rid of all those toxins from the day and
kind of reset things.
Reset things for the day. So we're really looking at brain health from, children as young as, Girl Scout troops and things like that, all the way up through the workplace so that people can take care of the one brain that they have and make memories for as long as possible.
Yeah, and I would assume, Kristina, this is something that employers would want. They would want their employees to go through a program like this because it would make them more productive, I'm assuming, in the end.
Yeah, for sure. And especially to have, I have personal Alzheimer's in my family, and if I would have had those caregiving tools and some of the things that helped me to understand how I can take care of my own brain, it would have been a huge impact, right? And it makes you value your employer more too. So it's just an overall good feeling.
Well, it's nice to know 40% is in our control.
Yes.
There we go. Thank you both so much for coming in and
Thank
talking with
you.
us about
Thanks
this.
for having us.
We have a link for more information about the Alzheimer's Association at kdka.com/talkpittsburgh.